confirmed COVID-19 cases. Last night, we announced a total of 521,318. We're happy that even with the targeted testing approach, which we adopted as a department based on the Ministerial Advisory Committee advice, our testing numbers continue to grow. Today, we've tested 3,078,202. This translates to a testing rate of 51,514 per million population, which compares well with global figures. The question that has been raised is whether the plateau that we're observing in some provinces is due to reduced testing numbers, or if indeed less people are becoming infected with coronavirus. And to assess this, we've had to look at a number of other indicators. We have seen now reduced hospital admissions and persons under investigations presenting in health facilities. We have not breached hospital capacity in all our provinces. Despite the surge, we have not seen a significant increase in the deaths. Whilst we are cautiously optimistic, it is still too early for us to make a definite conclusion regarding the observed decline. We need to continue to track all these indicators and ensure that our testing capacity reflects a realistic picture of our epidemiological status. We'll therefore only know for sure when there's a consistent decline over a period. It is worth mentioning that as part of improving the records of COVID-19 related deaths, in response to the reports on excess deaths, we had a meeting of our National Health Council where we have discussed this issue a few days ago. We will now require that all sudden deaths and those that occurred home must have specimens taken for COVID-19 before a death certificate is issued. I'd like to share a slide, a graph with you, which is an indication of some of the trends that we are observing. If you could just give me a few seconds to try and see if we can get the slides loaded.
Right, seemingly just a little bit of a glitch there in that transmission. We'll take you there as soon as that is sorted. And the Minister, of course, talking there about the latest indicators and telling us that they actually have not had any problems, as it were, with regard to the intake into hospitals, so the numbers being tracked there. And as Leanne had also pointed out, and the Minister picking up on that, 5 months to the day when the first positive case of COVID-19 was reported here in South Africa. And today we're talking of over 500,000 people who've tested positive for COVID-19 in South Africa. And of course, it is getting very real, but we are going to link you back now to the Minister, who is continuing to give that briefing.
1, 2, 3, fourth column, it gives you a Western Cape. The number is at 97,261, and Gauteng 183,090, Eastern Cape 779,844, KwaZulu-Natal 85,986. The KZN has actually increased to be higher than the Eastern Cape, but will probably soon be getting higher than even the Western Cape. Then the rest of the numbers are showing. And if you look at the next graph, it's the one that I would like you to have a look. This one gives us a 7-day running average of new cases per province of reporting. What we have seen firstly here is that whilst we report numbers for the whole country, we have seen lots of variations in different provinces. This has actually been very helpful because it gives us a sense of the changes that we see at certain levels, which will later actually translate to look at what's going to happen in other provinces. So the first line that we'd like you to look at is the yellow line, which is showing that around the 19th of April, you started seeing that graph growing alone and the rest of the other lines were not moving. And that growth was an indication of the early break of the Western Cape, when during the lockdown, the number started increasing up to a point where 2/3 of all patients in the country were in the Western Cape. This continued for a long time when the rest of the provinces were under lockdown and therefore did not show any increase until around the 7th of June. Around that time, the numbers in the Western Cape started taking a slightly different turn, which is a downward turn. That we have tracked for the past almost 2 months now, and we've actually continuously had fewer numbers of positive tests per day all the way on the Western Cape. For a long time, we didn't talk about it because we wanted to observe what this phenomenon was, because it was different. But we were able to confirm that the numbers of surge that were initially anticipated in the Western Cape did not materialize. Secondly, the numbers of admissions that we had prepared for did not actually materialize. Even the numbers of deaths that were thought to be expected at that time did not also rise to the level that was expected. However, the province was feeling a lot of pressure. We had opened up a number of field beds and even went to have agreements with the private sector so that they could take some of the patients. But all of that has never really been taken to filled up to capacity. So we'll see that that yellow line has gone all the way right up to the current date, where the figure is much lower than where it was on the 7th of June. Then about a few weeks later, then we see two lines that have taken off around the same time, around the 7th, 31st of May. We've seen that two lines, one is red, one is gray, and let's start with the gray one. That's the Eastern Cape. It mimics the lines that is reflecting the Western Cape, and it went up until the figures the figures were up around the 2,000 mark, and then around the 12th of July, then we started seeing the numbers slowly tapering downwards. And this trend has continued for the past 3 weeks now in the Eastern Cape. Now, this does not mean there are no new cases. It basically means there are new cases every day, but they are fewer than what they were before. And so this rate of growth has started slowing down. So the two lines are showing a plateauing and a reduction or a decline. And for the Eastern Cape now, this has been going on for 3 weeks. And that's been steady on the way down on a downward trend. Then the one that's been different is the one on Gauteng, which is the red line. That red line took off at the same time with the Eastern Cape, and then just around the 10th of June, it actually spiked up and started moving rapidly upwards, surpassing all the other provinces. Excuse me. And then it actually went up to as high as just under 6,000 positive cases per day. Those numbers stayed there for just a little while and then started flipping downwards. And we've now tracked it for the past 3 weeks. The red line is showing a slight decline, and that decline basically indicates that the numbers of new infections are increasing at a lower rate than what has been happening the whole of June and up to the middle of July, up to the 12th of July. That clearly indicates to us that there's a trend to decline, or a declining trend in Gauteng. So during this time, we've all felt the pressure. There were reports that the hospitals were full and so on, and we went around and we confirmed that it's the admission areas that were filling up. The filled hospital beds have never been full, and even today we have not filled Nasrec. A number of other hospital beds have not really been filled. However, the trends are now slightly decreasing. We're not out of the woods yet, because those who are managing the admissions and the treatment, hospitalization of patients can still feel that the wards are full and the beds are full, but nevertheless, we've not really gone to a point where we've got no space now for patients. Although the beds are full, they're not full to capacity, but they're actually being taken up. So that's another trend that we thought is important to show. So the three graphs now, as we look at them, it looks to us that the three might well have actually got the surges in the three provinces, reached already, and that we might be picking up a slightly downward decline. The fourth trend is the green line, which, if you look at it, took 2 weeks after the Gauteng and Eastern Cape. That's KwaZulu-Natal. Now, in this case of KwaZulu-Natal, it's tracking 2 weeks behind Gauteng. It's taken a similar trend, and it's gone up to a point where the numbers are very close to the 3,000 mark per day. And then slowly it's starting to taper off, but it's not easy to say that this one is decreasing because it's still very close to the peak, so it still can take any direction. We are concerned about this, and we believe that this is the area where the real pressure of the COVID is going to be felt, whilst at the same time we're feeling the same pressure in Gauteng, but it's going to be even more stronger in KZN, and that's the trend that we're seeing. The other provinces that you look at, the one is the orange line, that's the Free State, which has also started showing an increase. Now, what has happened here, the Western Cape continued to grow and decline despite the lockdown. And it was not a province where there was good quarantine and isolation and tracking of conducts in this particular area. In the others, the lockdown had actually delayed the rise of the numbers, but where you see the numbers rising is at a point when we move from level 5 and ultimately go to level 3, and then we started opening up economic activities and movement of people. So all of that is associated now with the change. And if you look around the 5th of July, that's an impact of a lot of economic activities that was open, particularly with the mining areas. And those are the areas that have had an impact on the provinces that have not been increasing significantly. We will need another 2 to 3 weeks to actually show and confirm that the trend is indeed a downward trend. But what are we learning out of this? What we are learning is that the containment measures, the masks, the sanitizers, the washing of hands, and distancing has actually helped to contain the infection in a way that is probably lower than what was anticipated. But most of the parts of the country, except KwaZulu-Natal and the other provinces, have really pretty much reached the peak point, and that this peak point is likely to continue in KwaZulu-Natal and the other provinces. However, we think it will be a slightly lower level, although the numbers for each province will still be very high. That also means that our biggest challenge is going to be, is this going to be maintained or sustained? So whether we sustain it or not is going to depend on whether everyone else can join in and start using masks and reducing distances and reducing funerals to 50 people, and then making sure that everyone washes hands and distancing and all of that. It's very, very important for that message to be sent across, because it is possible that instead of these lines going down, when we start opening up the movement of between provinces and opening more sectors of the economy, and people move more easily, the sporting and all the others, then this whole surge can come back again at a much higher level than what we're seeing here. And therefore, the message for us is that the indications are that the containment measures are beginning to bear fruit, and we may well be over this peak by sometime towards the end of August. But if we don't insist on distancing and use of masks, we actually can have a second surge. We have seen this happening. The US had these numbers, tracking properly, and then they went over the infection of the curve and went down. And when they thought everything was under control, then suddenly the surge came back and is much, much bigger than the first one that they had. And therefore, that's the worry that every country now is worrying about. The trend of how the pandemic has behaved like this is something that science has still got to find out. But the truth of the matter is that if we don't continue to contain it, it's going to actually get worse than what we're seeing here. Even the gains that we would have got by now would have actually disappear. We got the first gains when we were able to put the first lockdown, which was on the 26th of March, and all the restrictions actually delayed the curve to the extent that we were able to put up lots of field hospital beds, lots of staff was added, and we were able to now buy additional ventilators. We were able now to get oxygen to be moved around to be available to a number of areas. All of this together has actually been the benefit of the delay in the surge because of the lockdown. Even the level at which the peak has happened is less than what was anticipated, and we believe it's all because there was no infection that took place in the lockdown in most of the provinces. But of course, that the fact that it was not as much is shown by the fact that as soon as we opened, then we started seeing the infection going up. This is what we thought it's important to share with all South Africans, because at this point we are saying the few who are able to use masks and hand sanitizers and reduce the congestion and to ensure distancing are helping us to get this trend to be contained. But those who are not doing all the containment measures would be the reason why this would drag further and even resurge again. So the message is everybody need to take seriously these messages that we are sending through. I will leave it at that for now and just continue with the few other comments which I'd like to make. One is the issue on the healthcare worker safety and PPEs. As government, we have constantly given our commitment to the public that the protection of the health workers, including doctors and nurses, is of utmost importance. This workforce remains at the front line of our battle against COVID-19, and it is in our interest as government to ensure that they are protected. The Department of Health therefore notes with concern increasing allegations of health care workers contracting the coronavirus on the line of duty due to lack or poor quality personal protective equipment. We've even received reports that some may be dying after being infected due to the lack of sufficient PPEs or sufficient PPEs not being provided, and or failure or neglect by management to adhere to prescribed workplace safety protocols. We want to outrightly state that this cannot be tolerated. To give an example, a few days ago, my office was brought to my attention that there were public reports that a doctor had passed away at George Mukari Academic Hospital due to COVID-19 related illness. There were also allegations that this was due to lack of sufficient supply of PPEs and doctors being made to work in an unsafe environment at the facility. I viewed these allegations in a serious light, and I have decided to urgently appoint a team which is led by Professor Daulem Kwena, together with other medical nursing and legal professionals, to conduct an urgent investigation and provide me with a report in 14 days to from the commencement of this date of this investigation. This report will provide me with independent findings and recommendations. These will also be communicated publicly. I just want to assure members of the public that individuals entrusted with positions of power in health facilities or even at district level, if they are found to be in dereliction of duty by not ensuring adherence to health protocols, appropriate action will be taken against them. We encourage healthcare workers at this facility to avail themselves for this probe. I believe that this approach of zooming into the specific incidents will assist us to establish the real challenges and deficiencies occurring in the health facilities. It will also ensure accountability and promote a culture of heightened awareness of workplace safety. We have worked now with a number of unions who have been sending me specific reports, and also some individuals who send us information, complaints as whistleblowers We'll analyze all of this, and therefore this action arises because when we pick some of these up, we realize that there's a need in some instances to intervene the way that we have. The latest number of infected health workers that we have received from the provinces is totaling 24,104 workers. As at the 2nd of August, with 181 fatalities recorded, this means that the national infection rate of healthcare workers stands at 5% of all confirmed cases. We've also kept track of the level of infection on health workers globally, and on the 17th of July 2020, the WHO reported that healthcare workers account for 10% of the global infections. As part of continuous monitoring, we've requested provinces to further verify and break down this data so that we all know exactly how many health workers have demised, recovered, and the full breakdown of categories of healthcare workers. Whilst we appreciate that employees can acquire the virus both in their line of duty as well as in the community, we encourage employers in different sectors across the country to continue taking measures to minimize the chances of acquiring coronavirus in the workplace. Unions have also been raising their concerns about this workplace safety, the availability and quality of PPEs, and the mental and physical well-being of their members. We also recognize the critical role played by the unions in representing their members' views and concerns at the workplace during this period. We've noted the reports from unions collected through their fact-finding missions, and also the ones indicating shortages of PPEs in some hospitals. I have since instructed the provinces to ensure that PPEs are immediately made available at those facilities highlighted, and for the report to be made available. The provinces have also been instructed to ensure that occupational health and safety committees are established in every province, district, and health facility. This is to facilitate constant communication and cooperation between unions and management. I have now obliged all the provinces to ensure that these committees are fully formed and functional within the week, and they must meet at least once a week. In these occupational health and safety meetings, staff and unions must ventilate all the issues, and if resolution is not satisfactory, the complaints must be escalated to the relevant MECs. And of course, if that does not resolve them, the unions will be able to bring them to my attention at a national level. The mental well-being of our healthcare workers is equally important, more so during high-pressure periods like the one we are going through right now with COVID-19 surge. I've requested that in all provinces, work must be done at provincial, district, and facility level to promote psychosocial counseling to deal with the trauma experienced by healthcare workers, ensuring that they get support and manage the problems of fatigue and irritability and any indications of anxiety and burnout. Once again, this required a multi-sectoral approach, in particular collaboration with the unions, the lay councillors, and religious leaders. To my dear and esteemed colleagues, the doctors, the nurses, the physiotherapists, the psychologists, medical technicians, the pharmacists, laboratory workers, porters, and all general workers, environmental health practitioners, dentists, dental technicians, optometrists, all the frontline healthcare workers, for your commitment and resilience. We as South Africans are indebted to you. Thank you. Siyabonga, Rialibucha, Enkosi, Danki, Doribua. The other point I want to comment about is the bed and oxygen capacity. We continuously assess the availability of beds, oxygen, and staff complement. Whilst there have been constant constraints, work has been done to ensure vacancies are filled, but we can also confirm that we have not breached our bed capacity, and many of our field hospitals are not filled to capacity, and we continue to monitor this as we manage the surge. We have no doubt experienced challenges and glitches. This is no way unique to our country. I therefore want to submit with humility that up to now, our government has displayed its readiness and has thus far coped with the surge. We remain committed to taking all the measures necessary to protect our people. It appears we may have benefited from the treatment development as we were experiencing the surge. Our indications are that there has already been an improvement in the survival rate from our ICU, where the mortality has been reduced demonstrably. One study showed that ICU mortality has been reduced by about 25% since the introduction of dexamethasone on June 16. In other studies which is monitored by the MRC, ICU survival rate showed a dramatic improvement at 30 to 40%, whereas ICU mortality at the beginning of the pandemic was around 80%. Notwithstanding these encouraging scenarios, we've directed all provinces to enter into service level agreements with private healthcare facilities to ensure that when the bed shortages are experienced, that alternatives can be explored. We will be receiving a number of ventilators, and these ventilators are convertible in the sense that they are mostly used for CPAP and not intrusive ventilation. We'd like to distribute them to as many hospitals as possible, as in the same way we're doing with oxygen, because the first line interventions of oxygen is possible even in small hospitals, and therefore it's important that the equipment that is now been designed is usable even in small hospitals without too much of a problem. And from that point of view, we want to make sure that even people who are accessing our facilities at distant, small rural hospitals can get the chance of being able to survive even before they are able to get to the major hospitals in the major cities. The update on vaccines, while it is very early still early days, we have undertaken to get involved and invest in the development of vaccine against the novel coronavirus. Currently, we are participating in the CHADOX-1 study and in also the COVAX project to be part of the global research initiatives, as well as the access to vaccine program. We also wish to pursue the possibility of manufacturing vaccines locally. This is early days still, but nevertheless, our aspirations are that South Africa should participate at that level as well. We are going on with discussions and trying to find ways to be able to to be part of this initiative, and so we'll report as time goes on. Then we also just turn to the issue of the WHO support. I am very pleased to announce that the WHO has agreed to our request for their reinforcement as we continue to implement our national COVID-19 response. As we know, South Africa is now at the top 5 of globally in terms of the number of infections and with the highest in the whole of African continent. I want to pause therefore here to acknowledge the WHO Director General, Dr. Tedros Adhanom Ghebreyesus, for his continuous support and counsel. He never hesitates to give us a call, and he never fails to pick up our call whenever we need guidance, support, and encouragement. And we want to say, Dr. Tedros, thank you very much, my brother. We know that him and his team have had to carry the global burden in the battle against COVID-19. Today, we announced that the WHO will be sending 43 senior experts from across the globe, including the renowned specialists such as Dr. David Heyman, who is also a seasoned infectious disease epidemiologist and public health expert. I'm also pleased that Dr. Mike Ryan will be leading the team from Geneva and will now be focusing on South Africa and providing us with the constant advice, whilst analyzing our strategies, including the decisions we've taken as the Department of Health and the country South Africa in our COVID-19 response. We see this as a great opportunity not only to improve our health strategies during this pandemic, but also to accelerate our path towards healthcare reform. The first 17 experts will touch down on South African soil today and will complete a period of quarantine and initiation before being deployed within the department and across the various provinces. We are very, very pleased that President Cyril Ramaphosa has given us all the support throughout this process, and will certainly be participating in ensuring a reception of all these special teams that are coming through. And President Ramaphosa has continued to give support both to myself as minister and the deputy minister, as well as the department, but also we applaud the President for his leadership in steering this very, very difficult situation of a rising surge in COVID-19 infections. We can never overemphasize the importance of good human behavior and therefore the impact that it can have on flattening the curve. The containment measures being implemented are assisting. However, we must not be complacent. The real risk of experiencing a second wave of the pandemic remains, so containment measures must never be abandoned. Until we are completely safe, we'll keep reviewing restrictions, and if necessary, restrictions will still remain in place. The President has therefore asked us after such a presentation to ensure that we come together, we come back with various recommendations of what will be the next best steps to be taken. And so we will be tabling recommendations to the National Command Council, and therefore at some point during the course of next week, we should be able to get further guidance from the National Command Council and the President. We do want to thank all South Africans for your continued support and encouragement at each and every day. We want to thank all the health workers and the frontline workers. We want to thank the members of the media. We want to thank the public in general and those who are using social media, because quite a lot of information comes to us through all of these sources. We want to say to you, we have to continue the fight together, and we believe if we can continue united, we can strengthen our response in such a way that we can actually, in a few weeks to come, see ourselves getting past the really heavy battering of the COVID-19 pandemic. However, nothing is guaranteed. Nothing can be taken for granted unless we continue with the containment measures, which are the wearing of the mask, which are the distancing, hand washing, hand sanitizers, and reducing, gathering, particularly funerals, and responding to all the restrictions that have been put on for us to follow. We may actually lose all the advantages that we have so far gained. We never anticipated that the numbers will grow as high as they've gone. But what we have been able to do is what we said at the beginning, that government intends to ensure that we provide the health services in such a way that we can treat as many people without our system cracking and collapsing. At this point, we believe that we've been able to do that. We're not over the worst yet, but we believe that in the way that things are going, South Africans have really helped us to be able to navigate a very difficult situation, but it's not over. And we cannot let go of all the containment measures, and that's our plea. Let's please follow the containment measures and behave in a way that will ensure that even as we get to the end of the surge, we are not exacerbating the resurgence of the infections again. All of that is in the hands of all South Africans, but we as government have really been doing everything we could with your support to contain the surge. At this point, I'd therefore like to say thank you, and thanks to everyone. We may take some of the questions, and some we may probably just take them and send them the responses in writing because of the nature of the pressure this morning. And thank you to all the media houses for the support all the time. Thank you very much.
Thank you very much, Honourable Minister. I think we'll have time maybe for one set of 5 questions. And so I will go ahead and ask some of these. From Angelo Coppola at CGTN, his questions are, why has the daily testing rate dropped over the last 3 weeks? And I think, Angelo, you're probably covered on the latest with the vaccine trials, as the Minister has made some comments in that regard. Tabile Mbele from SABC Radio News. We have a case of a Johannesburg-based doctor who has been infected twice in April and June.
Hello.
Are you aware of...
I'm in a Zoom meeting.
Are you aware of more cases of health workers or individuals who have been reinfected? Is this a common occurrence? What does this mean about herd immunity that we were told about at the beginning of the pandemic? I have William Kiza from City Press. The minister has been on record to say that corruption around PPE procurement must be acted on immediately as this saga around the 2.2 billion tender scandal grows and how it also threatens its own action. On a more personal note, can you tell us what your comments or thoughts are that firstly, one of the leading MECs of health is out on the bench during this highly anticipated and anxious period towards the peak? Colleagues, please may I ask colleagues to all mute. I will continue with the question. On a more personal note, can you tell us what your comments or thoughts are that firstly, one of the leading MECs of health is out of the bench during this highly anticipated and anxious period towards the peak? Are you disappointed or upset over these allegations, particularly as this PPE saga directly impacts healthcare workers who have bore the brunt of this disease and are at its core base? What does the department do to address these allegations linked to the various provinces to tighten up controls around tenders for COVID-19 relief? Sue Njanji from AFPF, would you say daily infections are stabilizing? Would this mean we have passed the peak already, or can we still expect a peak in the future? And one last question, Minister Ayanda Melanze from Mukozi FM. We saw video and images of makeshift shelters at a Pietermaritzburg hospital parking lot where a 67-year-old father died seated on a chair at 2 a.m. in the morning being treated for COVID-19. Looking at that video shared by his daughter, Hlengiwe Khumalo, and thinking of a very ill person, is that the standard condition these shelters should be in, or is it negligence by the hospital? He complained about feeling cold and was told nothing can be done about it. And the second question from the same journalist, Ayanda Melanze, nurses, especially in KZN, are complaining that they are being told to hide COVID-19 cases. Prince Msheni and RK Khan, to mention just two. Also, due to lack of PPE, nurses refuse to treat patients because they are scared of being infected. At Msheni, an elderly lady was left unattended for hours because none of the nurses wanted to be in contact with her. Unfortunately, she didn't make it. Is there room for health professionals to report such acts to the National Department because they are scared to question their management, so they do as they are told to avoid being victimized? Thank you, Minister.
Thank you very much. I'll try to cover as much as is possible. Why has the daily rating dropped over the last 3 weeks? I think if the colleagues could recall that way back when we announced a differentiated approach to the infection, we then defined what we call hotspots and low transmission areas. And then we said, because it was clear where the pressure was coming from, all the provinces had to shift their testing, focus on the high-risk patients, focus on the patients under investigation, those who are coming to the hospitals, those who are contacts, those who are health workers, so that we deal with the area where there was highest risk. That's when we changed. Some people said there's a new strategy in the Western Cape, and we kept saying there's no new strategy. It was one strategy. You might have even seen some of the members members of the Ministerial Advisory Committee who went out and made a lot of noise about that. They suggested there should be a change and so on and so on. That's why we all changed. So that meant we're focusing on the people who are coming through from these particular sources. Now, those numbers have been slowly decreasing, and that's really what has been happening. If you look at the number of daily tests, we've actually gone up to 40,000 per day. We went up sometime to over 46,000 and so on. So we have had large numbers of tests being done. However, excuse me. However, the testing rate, we were actually seeing a very high positivity rate at that level. So when the numbers were coming down, it was in response to the patients who were being targeted for testing. Those are the things that were determinant at that particular level. The issue around the vaccines, I've kind of addressed that we want to participate in the trials. We've started on some. We're involved in negotiating discussions with the Global Alliance on Vaccine Initiatives, as well as a few other manufacturers of vaccines to look at what is possible for South Africa at that point. The other question was about someone who's been reinfected, infected twice. This is a new phenomenon, and from where we have been observing it, it's happening. It's not a very frequent phenomenon, but it's something that we all have to learn about what has happened in this case. There are these few instances, and we've said that our researchers must try and track them so that we can compare with what's happening in the world and also find out whether, in fact, there is any lessons that you can get out of that process. And all we can say is that it's not a frequent occurrence, and whether this has to do with the antibodies that are short-lasting in the body, we can't tell. Whether it has to do with the severity of the initial infection, that it might have been milder, then it comes back again. No one really knows for a fact what the situation is. I think with time, because this is an issue that's been raised a few times, it will be clarified as science. We've not even finished a year with COVID-19, so there are too many questions. There are too many questions that we have not really been able to get answers to. Then we raised the issue of corruption. I'd like to just make a few specific statements. Firstly, that there is no room to tolerate corruption anywhere in the issue of the procurement of the PPEs, also in the question of any other part of health services or government in general. I think the president has actually made the statements very clear on this in this regard, and all cabinet and all ministers are quite firm on the fact that we are going to uproot corruption and we're determined to do so. Yes, indeed, we wouldn't like to find the problem of corruption arising in the team that you're working with. And so the allegations have been made, the decisions have been taken in the Gauteng. We have to respect those decisions. We have to make sure that everything is done to properly investigate this matter. At the end of the day, those who are culpable need to face the full might of the law. And in this case, it is indeed a concern that one of the members on our team of MECs, right in the middle of the search, has been asked to step aside. But it's only correct to do so when you have to deal with a situation where the approach on dealing with this matter requires investigation. And so we hope that that matter will be taken to its full conclusion. We would have loved to have the whole team working during this period. However, when there are serious allegations and challenges and such concerns, we have to understand that steps will be taken that might be uncomfortable, but at the point, at the end of the day, we have to actually strongly fight corruption at all levels. The other issue that has been raised relates to whether we're stabilizing at the peak. I think we have shown the different approaches to I'm not sure I'm still audible. It looks like there's been some action here. If I can just proceed, I think there's just been a bit of an interruption here with the power supply. So the next question relates to the stabilization of the peak. Everything depends on how South Africans behave. We could have gone through this peak. If you look at the numbers that we have shown, it indicates that the major thrust of this might be declining, but we are not out of the woods yet. The numbers are still very high in Gauteng. There's still a lot of pressure in Gauteng. in the Eastern Cape, even in the Western Cape, everyone is still feeling. However, you can still get the signs now that in some instances this might be receding, and so we need to manage it very cautiously. And we can be able to maintain this if we keep the containment measures. And it can easily turn around and go up again with an upsurge if people let go of all these containment measures. I think it's important to say those who have managed to ensure the containment measures, use of masks, and hand sanitizers, all of those, they have helped us to be able to see the surge slowing down. But those who have not are actually posing a risk that this thing can actually open up again and then still increase. Then there was another case which was reported in Northdale Hospital in KwaZulu-Natal. It was, of course, shocking to see again what happened. And we would not like our people to be treated under those kinds of circumstances. I have therefore I've spoken to the MEC and directed that the matter be urgently investigated. I have already got the first report that they have gone into the area to make sure that we find out what is happening. I will receive the report by the end of the day. We must actually make sure that actions are taken in this regard. And so we will await the report which the MEC is going to make available by the end of the day. We do believe that management has to take seriously the conditions under which our people are being treated. And it's important also that everyone must tell if there's a problem of the layer above them. Everybody must be able to come out and indicate so that you can intervene. There have been a number of instances where people felt there were blockages that were to intervene to ease off those blockages. And similarly, the question that is relating to the nurses who are being told to hide this condition, they need to write to the MEC and write to the minister. We will be able to deal with that issue. And they must also report to their unions. Unions, they can, at any one time, if there's such an issue, they will be able to inform us. They will be able to get us to intervene. No one must be intimidated to hide their status. Everyone must be given proper guidance and proper counseling so that they know how to deal with the issue of the COVID situation. And it's important that no health worker must be exposed without proper training and preparation and protection to go into a risky situation. We have found that there are differences in the understanding of what level of PPE is needed. If you are working in the as a general assistant or as a cleaner or as a porter or as a nurse in the general ward, in the wards that are non-COVID wards, we've seen that there are differences of understanding, and we have said that management must meet with unions to make sure that is stabilized and everybody has got the same understanding. We also then need to make sure that even in the areas where people are sitting in the cafeteria, in the staff rooms, staff offices, when people are relaxed and they're chatting with friends, that's really where a lot of infection also is taking place. Tea rooms in the hospitals have been seen as some of the areas where there's a lot of concern. I may as well just add this aspect as well, particularly in all the areas that we're still getting the numbers high. It's important to say for the senior citizens and those who are having comorbidities, don't take any flu for granted. You get some symptoms, get assistance. Don't stay at home and say it's going to get better without being checked. Go and be checked and make sure that you know it's COVID-19 or not. It is very, very important because what we've seen now, a number of senior citizens, older people tend to have a flu for a day or so. They say, well, I'm going to get better. On the third day, they can hardly get out of bed. They can hardly breathe. And by the time they get to hospital, it's too late. We need to make sure that we don't take it for granted. You have a slight flu, you're not happy, get the doctors to assess you. That's why we're also saying we want to check what is happening with the people who are dying at home, where we've seen excess deaths, and we want to just reduce that number so that we are able to account for people who could have been infected. So we are now calling that for funeral parlors must assist us. Don't just get the doctors to issue a certificate. Let's do a swab. If somebody passed at home, that we need to know if there was in fact COVID at the back of it. And so that will actually reduce the numbers of excess deaths due to COVID where we are not able to explain what has happened. So all of these are the messages that we're sending through. We're not out of the woods yet. Let's continue the fight. But so far, we've really fought a good fight, and we must really keep up. But we have to continue. We can't let go, and we can't release on all the, containment measures. Is very, very important. We must also say that we've been able to, reduce the pressure in the hospitals. But we do want to encourage people to come back to hospitals for normal ailments, chronic diseases, heart diseases, immunization, family planning, and all of those. We want people to continue to get that normal treatment now so that they don't start having the problem from what was already controlled before, HIV, TB, and so on. We want to try and balance all of this up. So the easing of numbers are saying we have actually got time for people to come in. Don't fear coming to the hospitals. We are now triaging everyone to make sure that you try and separate the entry points so that those who've got symptoms need to be dealt with. We've also reduced the backlogs so that there's a quick turnaround time. KwaZulu-Natal was the one that was remaining behind. We've actually moved some of the provinces have taken over to do some of the specimens so that we can clean up and reduce the backlog so that we can quickly diagnose and not have someone who's got an infection sitting next to someone who's got a heart failure because we couldn't make a distinction. So all of that, we're actually trying to make sure we cut down on the numbers so that after this, we must hold on vigilance where we try and reduce the numbers completely so that they don't continue to surge again, but it's all up to us. Let's continue with the containment measures. Thank you very much.
Thank you very much, Honourable Minister. And it is now 4 minutes to 8 o'clock. We unfortunately do need to let the Minister go. Thank you all very much for joining this press briefing. Thank you, Minister, so very much for that very, very important message to the public. Everybody, please keep your distance. Let's all wear our masks, wash your hands, and let's keep the faith and let's keep going. We will beat COVID-19. Thank you very much, everybody. This closes this press briefing.
Thank you.
Well, that, of course, the latest briefing by Health Minister Dr. Zweli Mkhize there. The message, we're not out of the woods yet. The next 2 weeks or so are going to be very important in pointing the direction as to where we go. A very important issue is touched on by the minister there, saying that we need to guard against going the route of the United States of America, where they thought that the numbers had dwindled sufficiently for them to open up, only to see another spike. And we don't want to be doing the same thing. Also touching on a very important issue of people dying at home and saying that there needs to be more done to try and establish why this is happening, why there's a surge in those numbers, and people need to know, we need to know exactly what it is that they are dying of. Also questions raised about reinfection and the like, and of course the capacity of our hospitals and healthcare facilities to deal with this pandemic and patients being taken up. So all of those being told to us by the minister, giving us the latest update as to where we are in this fight against the COVID-19 pandemic. Let's take a quick break before we bring you the news at 8 with Leanne.